So people, in this video, let us look at this question recently asked in the anatomy final exam, cubital fossa. So cubital fossa, what and all they're asking about it? The boundaries and the contents of the cubital fossa. Asked in November 2023 anatomy final exam. Now, first of all, what is cubital fossa? So you know that in the front of the elbow, you have a triangular hollow, which is the cubital fossa. Okay, so you have to draw diagram, then only you will get marks. So first of all, you will draw a man, very basic diagram first to show the high level anatomy where exactly it is between the arm and the forearm. You just draw one triangle like this, and that is the cubital fossa, right cubital fossa done. Okay, now you have to draw what? The content they are asking, correct? Content of the cubital fossa. So let's draw off content first. So I'm going to draw one triangle here. People focus. So draw one diagram. So you'll also get clarity. First, if I used to draw off diagram, okay, and then only I used to write theory because I used to also get bored writing so much in the exam. So you draw one nerve here and draw one nerve here also, okay, and some branch for nerve also you can show if you want. Then coming to one artery here, that is the brachial artery, that also divides in the end like this. Very important to show. Then in the center you can show one tendon. Tendon is of one muscle. Which muscle? Biceps, your favorite muscle. Okay. So how to remember? Very easy. Don't worry. M, B, B, R. Okay, MBBR, not MBBS, MBBR. So on the medial side, you start off with M. Okay, on the lateral side, it is R. Radial nerve. Everybody knows radial nerve only is lateral, correct? So what and all you drew? MBBR. What is M? Median nerve. See, it's a yellow color here. Median nerve, median nerve. Then what is B? Brachial artery. Termination of this. Then it is dividing here into two things. What is it dividing into? Everybody knows. Ulnar artery and radial artery. Very good. Then here you have a tendon, which we have shown in green. So which muscle's tendon is it? The tendon of the biceps muscle, bicep brachii muscle. Very good. Then R is what? Radial nerve, and it's some branch we have shown. Okay. Got it? MBBR, cubital fossa contents done. Really, ma'am? Is it done? Yes, but the textbook gives more information. Textbook is explaining median nerve is supplying what and all. See, textbook is giving more information. The median nerve is supplying so many muscles. Okay, now let us come to the boundaries. What do you have on the lateral side? Muscle. I can see one muscle here. What do you have on the medial side? In the boundary. A muscle. Very good. Muscle and muscle. On the lateral side, you have one muscle. Brachioradialis muscle. Which muscle is this? Brachioradialis muscle. Which muscle is this? Brachioradialis muscle. It's on the lateral side. Very good. What is the muscle on the medial side? Ma'am, on the medial side, it is pronator teres muscle. Which muscle? Pronator teres muscle. Over. Boundary. Lateral and medial boundary over. Okay. Now, take a deep breath. What is this? This is the base. What is this? This is the apex. Base and apex. Very good, because it's triangle. Now tell me, what is the base? Base is an imaginary line that is joining the front of the epicondyles of the humerus. So it is an imaginary line. So because it is imaginary, I will draw in dotted line or something. So it is an imaginary line here which is joining the front of the two epicondyles of the humerus. Okay, what is apex now? Come to apex. Apex is the, it is directed downward. It is nothing but the point where the brachioradialis muscle meets the pronator teres muscle. So nice. Very good. Boundaries done. Boundaries done. But does boundary also mean that you have to explain roof and floor? Okay, let us see of roof and floor also. Roof is there what? Roof means what? On top, what is there? I know what is there on top. What is there? Here, skin. Very good. So, if I start cutting, what will I get? First, I'll get skin. Then I'll get some superficial fascia, deep fascia. And then I will get some aponeurosis. What is that aponeurosis? bicipital aponeurosis. So what is there in the roof? Skin you have. Then you have the fascia, that is the superficial fascia, which has the median cubital vein. Very important, this term. The median cubital vein is there in the superficial fascia. In the roof of the cubital fossa, you have the median cubital vein. Very important, because that is from where you're drawing the blood. Correct? Phlebotomy. So median cubital vein, you have to write 100 times and underline it. Not 100 times. You have to just underline it. Write it in bold and underline it so that they know. Okay. And then you have some nerves, etc. here. Okay. So roof you got no skin fascia with the median cubital vein. Okay. And then you have some aponeurosis. Okay. Now coming to floor. What is floor? Floor, ma'am, means once we remove the contents, whatever is left, no, that is floor. Very good. Very good. So we'll remove the contents. And now when you remove the contents, what will you see at the bottom? Ma'am, we'll see muscle. Yes, very good. Some muscle only will be there. Which muscle? Brachialis muscle and the supinator. Okay. This much if you remember enough. Okay. This much you write in the exam. So if you draw this diagram, content though you have learnt. Content diagram, you are master MBBR. Okay. Now this roof muscle also, roof photo also, if you learn of, no, you'll get off super duper marks. Okay. What you have to do, no? You have to draw one blue line here. You have to draw one blue line here. And then you have to join it like this. That's all. And this one you label as B and this one you label as C. From medial side, B and then C. And then middle, this one is there. No, this only is our very famous medial cubital vein. Okay. What is B? Basilic vein, and C is cephalic vein. So somebody will come and ask you, where is the cephalic vein in the human body? You'll be like, cephalic vein now. Oh, is it in the head? Okay, because it's a vein. So it's going to drain like this towards the head. Let's write some clinical anatomy. Always at the end, you should add clinical anatomy. So cubital fossa is where you do all this phlebotomy. From where do you get the blood? Median cubital vein. Very good. Also, where do you put the cuff? The blood pressure cuff. Can you measuring the brachial artery? Okay, pressure. Okay, this much if you write phlebotomy and this blood pressure cuff around the brachial artery, you will get clinical anatomy marks also. So basically, our five marks we have got. Bye bye.